Okay guys, we're back to the Sales Academy, and what we're going to talk about in this video is the list that you need to create to have an effective prospecting session. Okay, when you first think about prospecting, I just mentioned in the last video about setting goals and making sure that you're doing and you're accomplishing the certain things that you need to do, like the how many phone calls in that in that short time frame, because Parkinson's law says that you're going to try to stretch out the time that you need to take, that you need to do anything unless you're very specific and focused. So for you, you need to remember that it's hard for people to hustle. It may be hard for you to hustle to make those calls, unless of course you have a list first. What I see a lot of sales reps and sales managers do is they come in every single day and they get ready for their call session, they get ready for their phone blitz or whatever they call it, and they get up to their computer and they say, okay, who am I calling today? And then they end up spending their time, right? Should I call on this person? Should I call on that person? Those people? What does the note say about this individual? And what happens is they're procrastinating, right? They're procrastinating, and it's taking so much longer for them to actually start dialing that phone. Dial that phone, right? If you want to have a great session, you should have been ready. You should have had your list done, and in that list is what you should make sure that you have done before you even get started. For instance, right, if it's a Saturday or Sunday, it's the weekend, you should be thinking about, whom am I going to call next week? I need to make 40 phone calls a day. So that means I need 200 people, right? So then you're going to say, who am I going to call Monday? Who's my Tuesday, Wednesday, Thursday, or Friday? What is going to be that list? What do I need to do for that time? What is it going to look like? Or am I calling the same exact 40 people 5 days of the week? Right? So you have to understand, what are you deciding to do? So think about it right now. What does that list look like for you? It takes time to put it together. Just let you know, there's no perfect list. The best list is one of the lists that you can actually start. Because over time, when you're calling these people off your list, you're going to be adding information to it. You're going to be adding data, qualifying information. That's going to make that list even stronger. And in the beginning, don't overdo it. Just think about, do I have people to call every single day? And is it clearly defined for me? If it is, fantastic. Now, here's some things that I recommend that you should have in your list. You should have 3 contacts. 3. The best you can, you must try to have 3 contacts. What do I mean by that is, a lot of times it's the CEO, maybe it's the CFO, maybe it's a CIO, the Chief Executive Officer, the Chief Financial Officer, and the Chief Information Officer. That's what they mean. Or it could become the President, the Controller, or IT Manager, depending on what products that you're trying to do. So those are examples of what we call 3 contacts. And it's going to vary, and it depends on the industry, the company that you're in. And maybe you actually might need the office manager, or you might need the purchasing manager, or the accounts payable manager. It just all depends. And this is something that is part of your research, right? But in the end, you should have at least 3 contacts. And don't think that there's only one person you need to be able to talk to on these accounts, because depending on the size of the business and how much customers they have, there may be multiple responsibilities. And what your job is to find out who they are, who can make the decisions, who are the key players, the decision makers in those companies. So remember, 3 contacts is the main goal, right? 2 is okay, 1 is kind of pushing it. Now, I've talked about prospecting in the field or cold walk-ins. I have that in another course, right? And we're going to discuss that later on in that video series. But in the end, the difference between cold calling and cold walk-ins is that cold walk-ins, it's a lot easier to get the names because you're right there. And when you're making the phone calls, you might hit your gatekeepers, right? And so that is just where you're placed. Okay? You need to be able to understand and differentiate the fact that there's a difference between a cold walk-in and a cold call, okay, in regards for prospecting. Now, the next thing I recommend that you have, is pretty much looking into these individuals, right? And what you need to be able to do is, by looking into these individuals that you're going to be reaching out to, right, you want to also kind of do some basic research. You know, like I said earlier, maybe you can do it in the weekends to do the research you're going to call in the weekdays. I've also done it in the past where I'll spend one day, and this is pretty much what I call my data research, my data gathering, where, maybe I'll spend a whole Monday. And then that Monday, I'm going to create my list. So if I know I'm targeting 200 people this week, right, I'm going to spend an hour, find out who those 200 people are, but then spend a couple hours just trying to go really fast and trying to research these people. I'll use LinkedIn, for example. That's a great way to be able to find out, who's the CFO, who's the CEO, who's the CIO of a company. All you got to do is plug in the company's name in LinkedIn, and you can just click on the employee section and start looking down by looking at the titles of the people who are employed in that company. So that's really important when it comes to building a list. Okay, and once again, don't forget the phone numbers. That's important as well. And then once you have all those informations, you want to be able to put that down. Now, the question is, where do you put all that data? Okay, a lot of people still out there uses Excel spreadsheets, and then the old school people still use just a paper, right, their notepad and everything. What I truly suggest is that when you're going to be prospecting, when you're going to be reaching out people cold call, when you need to be able to start putting a lot of notes, time really matters. And so get a CRM. It's a customer relation management system. Okay, so that's my big suggestion. Now let's go ahead and move on to the part 3, of the preparation for cold calling video series. Let's go ahead and get started. Hey everyone, we want to be able to invite you to our 10xpatientreferrals.com, where we have our online home health marketing academy that's going to be able to help either a home health, home care, or hospice agency increase referrals, increase their census, and create a profitable company. Now, at this very moment, you're going to have access to these information through these training, marketing to physicians, how to get to hospitals, how to be able to get into nursing homes, and much, much more at a month-to-month basis with no contracts needed. It's just month to month. Now, guess what? We are offering you guys for a limited time 50% off any one of our plans. Just choose which one is going to be able to work better for you. So just stop by the 10xpatientreferrals.com at any given moment. So these are the plans that are available, whether it's the gold, the silver, or the platinum plan. Most people go for the gold plan, but it's up to you what's going to work for you. We definitely want to be able to have you come in and work with us. So here's 2 choices. Go to 10xpatientreferrals.com or click the link down below. Take advantage of this right now at this very moment and sign up with us. We would like to thank our sponsors of this video. And over here at 10xpatientreferrals.com, our goal is to provide you guys amazing information on every single one of our videos. So medicationreminderprogram.com provides daily medication reminders for your patients. They call your patients twice a day to remind them to take their medications. What happens is a top reason of hospitalization for senior citizens is not taking their medications. So this program allows you to be able to keep your patients and not lose any revenue, but at the very same time, it allows you to stand out when you are marketing to other referral sources because you're providing more services, more programs than the competition around you guys. The next thing we want to be able to share with you guys is they have 3 different packages available for you at this very moment. Choose which one works for you. If you're an agency that's just starting up and you have less than 10 patients, you can go with the silver plan. Or if you have 50 patients, you can go with the gold plan. Or if you have up to 100 patients, it is only the choice to use the platinum plan. But guess what? It's up to you which one works for you guys. For a cost of as little as 33 cents per patient a day, it is worth everything for you guys. The next thing is homecareansweringservice.com. It's an answering services for your agency. So if you want to be able to have us handle all the calls for you in the weekends or the off hours when your business office is closed, we can definitely do that. Or we can even answer your calls for you during the day as well. Allows you to be able to do everything for your company. So homecareansweringservice.com is your solution for answering your calls on a timely manner. Now, before we continue on to the video, just need to be able to take a few seconds of your time. And so we want to be able to ask you a question. Are you looking to gain more referrals for your agency, your home health, your home care, your hospice agency? we want you to be able to join us at our Online Marketing Bootcamp that has over 7.5 hours of training. When you actually watch our bootcamp and join our Online Marketing Bootcamp training, so sign up for a limited time at 10xpatientreferrals.com